Good morning. I'm Tom Mortell, Chairman of the Board for the Boise Metro Chamber and partner at Holly Troxel. Thank you all for joining us today for our 9th Annual Legislative Leaders Forum. As with so many recent things in 2020 and extending now into 2021, this is our first virtual legislative luncheon. We're so grateful to our community and the Chamber members for their flexibility during this challenging time. Before we begin, we'd like to thank all of our sponsors who continue to support the Boise Metro Chamber. In particular, today's event is presented by the Idaho Statesman and is sponsored by Blue Cross of Idaho, Intermountain Gas, Optum, Idaho Central Credit Union, and Southwest Airlines. Finally, I would like to thank our state legislators who are tuned in and watching this event. We look forward to working with you this session, and thank you for your service to our communities and to our state. Now it is my pleasure to introduce our host today, Lindsay Moser, Director of Public Relations and Communications for the Boise Metro Chamber, and who will introduce today's presenters. Lindsay.
Thanks so much, Tom. Appreciate it. Good morning and welcome to the Boise Metro Chamber's Legislative Leaders Forum. On behalf of the business community, I'd like to welcome members of the state legislature to Boise and thank them for your service. The Chamber's membership thanks you for working on the critical issues our community and state faces. Before we hear from our panelists, LaBeau and Beth Oppenheimer, I'd like to thank our sponsors for this event. The Boise Metro Chamber is Idaho's only 5-star accredited Chamber of Commerce, and we are committed to providing high-quality education and professional seminars, even during COVID, which is why we have been doing these virtually. In order for us to continue these educational webinars, we receive great investment from our members. Today's event is presented by the Idaho Statesman and is sponsored by Blue Cross of Idaho, Intermountain Gas, Optum, Idaho Central Credit Union, and Southwest Airlines. We also would like to thank all of our district sponsors who continue to support this event. Now it's my pleasure to introduce our 2 speakers for today, starting with Beth Oppenheimer, Executive Director of the Idaho Association for the Education of Young Children.
Thank you so much, and good afternoon, everyone. I want to first say thank you to the Boise Metro Chamber and all of the sponsors for inviting Alex and myself to talk to you a little bit about a very impactful issue facing Idahoans. Idaho AEYC has been working to advance opportunities for early childhood education for many years, and we know that early childhood programs and services are critical to the healthy development of young children, but we also know the impact that early childhood has on our working families, our business community, and our economy. Oftentimes when we think or say early childhood education, we often think of just preschool. But early childhood education encompasses all programs and services that serve children birth through age 8. It includes childcare, preschool, home visiting, Head Start, etc. For today's discussion, we are going to primarily focus on childcare and discuss the impact that it has on Idaho's workforce and our economy. As you know, Idahoans have a very strong focus on family and community, and here in Idaho, we have a tremendous opportunity to attract employees and businesses to our state, but one of the biggest challenges that we face is that working families need access to high-quality, affordable childcare. Last year, Idaho AEYC and IACI partnered with the U.S. Chamber Foundation to better understand the unique needs of Idaho's working parents and examine the current child care landscape. The Chamber Foundation produced a report that highlights some of the challenges that we face here in Idaho. In addition to that, last year was also very significant in that Governor Little authorized Idaho AEYC to apply for a federal grant that gave us the ability to explore Idaho's early childhood systems, programs, and services, all in an effort to build and enhance opportunities to best serve young children and families across the state. So Alex is going to spend a little bit of time talking about the results of the U.S. Chamber Foundation report, and then I'm going to take some time to talk about what we have been working on to address these challenges. So with that, I'll turn it over to Alex.
Thank you, Beth, and thank you, Lindsay and Tom. And thank you to the sponsors of this, as well as the Boise Chamber of Commerce, and our opportunity to explain some of the results of all of the work that has gone on over the last couple of years as we try to tackle the workforce issue from our perspective and explain some of the economics associated with what this means to employers around the state. Just by way of introduction, my name's Alex LaBeau. I'm originally from Twin Falls, Idaho, Boise State grad, and I've been leading the Idaho Association of Commerce and Industry since 2006. Our top priority organizationally is the area of workforce. And one of the main components associated with that is how families interact with their employers and what employers can help with families as they attempt to deal with the area of childcare. The other unique aspect of Idaho is because we are so economically and culturally different across the state, because Eastern Idaho is different than Western Idaho and Western Idaho is different than Northern Idaho, but we are all one state. And trying to get a one-size-fits-all program simply is something that isn't politically feasible, as well as works for all families. So working with Beth and their organization, as well as the U.S. Chamber Foundation, we've had the opportunity to really explore some of the factors associated with this.
That's great. Thank you guys both so much for your introductions. And before we do begin and jump into their presentation, we do have a video from the U.S. Chamber Foundation that I would like to share now.
The Welch family daily routine. My youngest typically hangs out with dad and snuggles dad for a little while. My oldest typically likes to help make breakfast. It's okay, you got it.
Okay, like this.
My husband started a small business about 1.5 years ago, and I work at a hospital. And so childcare is an essential part of what makes our family run.
Mama, I see the sun.
You see the sun?
It's wake up.
It did wake up, didn't it? I work at Kootenai Health, and Kootenai Kids is just across the street. If they didn't have daycare here, it would be a big challenge. We would have to figure out other options, whether it be some extended family or things like that, but it would make our day-to-day routine much more difficult.
We recognized the need about 30 years ago for daycare for our employees. So we started Kootenai Kids. We really care about our employees. We really care about their lives. We want work-life balance. If we can provide this resource to them, it really puts a lot of ease on our employees, allows them to not have those type of worries that I think a lot of parents have to have.
We open at 5 a.m. and close at 6 p.m. We have children that are here for a couple of hours to children that are here 12 hours a day. And their schedules can vary. Some of them come once a week, some of them come all 5 days. It just depends on what their parents do at the hospital.
My husband, owning a small business, his hours are often very unpredictable. So typically it's me that does the drop-off and the pickup. If I have a meeting that runs late or something like that, they're comfortable there. So I'm absolutely happy to keep them there as long as they need for the day. It's nice to have the flexibility.
Kootenai Kids is probably one of the most valuable things we have for our employees. In the last 3 years, we've grown exponentially. We're at about 170 kids, and there's probably a waiting list right now of over 100. The reason we did it was for employees more than anything. But what we've come to realize, it's been such an unbelievable resource for the ability to recruit and retain people. And we're a community hospital, Kootenai Health is. We're community owned, we're community operated, and we really value that. And the people who are living within our community have Kootenai Kids available to them and for their families.
Bye, Grace. Bye, Gracie. Bye, Mickey. Bye, Ayana.
Yeah, it's great for retention and recruitment, but I think we're doing a really good service for not only our employees, but the people in our community.
Thanks so much for that video, again, from the U.S. Chamber Foundation. Again, I'm so excited to welcome Beth and Alex to today's event. It is now my pleasure to turn over the screen to both of them for their presentation on early childhood education.
Okay, let's kick it off. In the last video, you saw the website, and we can provide that additional information to you as we move forward. All of these untapped potential, we have a number of these booklets. If you'd like to get one at the end of the presentation, let us know or contact the Boise Chamber. We can make sure we can put one of these in your hands. When we approach this issue, our organization, which is made up of a lot of large employers around the state, looked at it from a workforce retention and recruitment, just as was said in the video. The issue associated with it, though, is I don't think that many employers quite recognize the magnitude of how this impacts their bottom line across the state. In addition to some of the statistics that you just saw, one of the things I think that was most telling is that 1 in 6 families that were surveyed across the state of Idaho working with that have children in these age groups, 1 in 6 has had to separate from employment as a result of childcare. 1 in 10 has had to refuse employment as a result of that. And that becomes very concerning to us, let alone the fact of absenteeism, which has translated to about, on average, 16 days a year per family. For employers, that becomes real dollars and cents, and this becomes a workforce issue of which our organization thinks that we can address from that workforce productivity and profitability standpoint. Trying to replace employees and trying to retain employees is something that our employers struggle with and even struggled with prior to the pandemic and currently are still struggling as a result of the pandemic. Many of our employers obviously are large enough to be able to take this issue on. And we've looked at it in a variety of different ways as to whether or not we would partner with other organizations to provide childcare within some of our facilities. Some of our facilities we can't have children in. So we looked at how they would provide those facilities outside of their operations. Many of our members are underway in decisions about how they are going to proceed with this particular benefit. I think the thing that was also telling about some of the additional survey work that we did over and above this information was how the entire workforce within all of our operations really valued the idea that employers would undertake taking care of these childcare issues, because that very issue says to an employee that the employer really does care about the employer really does care about the employees and wants to work for companies that provide that. That's all great for large employers. But as all of you know, we're not just large employers in this state. There are medium and smaller employers in the state that have the same exact problem, the same exact issues, but don't have the capacity to be able to fund childcare, put in facilities, or do the things like what Kootenai Hospital was able to do. So what do we do for them? And I think that we can continue to work on these types of issues in a way why we worked with Beth in the collaborative way to move forward with that. So that's kind of where we started with this program and kind of what we were doing with Beth and her group as in supporting the PDG grant and how we will continue to move forward with that. Beth?
All right, thank you so much. And Lindsay, if you could switch the slide, please, to the preschool development grant slide, that would be great. So as I mentioned earlier, last year, and for the very first time, Idaho was the recipient of the federal preschool development grant. But before I talk about what we've been able to accomplish in this grant and our plans moving forward, I want to address the fact that the name Preschool Development Grant, it's a little bit misleading. The PDG has gone through an evolution of iterations over the past several years, but the name has remained the same. Historically, and under the previous administration, the PDG is what we call it, was designed for states to help them build or expand preschool programs. But under the current administration, this grant shifted its purpose a little bit. And the current PDG is not for states to necessarily build or expand preschool only programs, but rather it's designed to fund states to conduct a comprehensive birth through 5 needs assessment followed by an in-depth strategic plan. The purpose of this grant is also designed to enhance parental choice and knowledge and expand the current mixed delivery system that consists of a wide range of provider types, including childcare centers, home-based childcare, Head Start, pre-kindergarten, etc. Next slide, please. This past year, we have utilized the PDG to address our early childhood system. We conducted a statewide needs assessment, which will be released just next week, so you'll all have an opportunity to see that. And what we found is that there are many gaps in our early childhood system in and of itself, but there are also a lot of opportunities which we will be addressing over the next several years. Next slide, please. In regards to the opportunities in front of us, we're focusing on supporting communities and families by building those opportunities for young children and families by creating comprehensive approaches to childcare and early learning. And we have begun to lay the foundation and the groundwork to ensure that all families have access to high quality, affordable childcare and early learning. One of the biggest things that we learned from our needs assessment was that families did not necessarily know where to turn to for programs and services, or they simply were not available. We also learned that many parents did not understand the impact and benefits that quality programs have in regards to their children's success. That is why we launched the Step Up campaign last year as part of the PDG. This campaign is designed to build connections between families, business leaders, policymakers, all in an effort to illustrate how each of us plays an integral role in enriching the early learning experience of Idaho children and supporting families. Step Up Idaho will help Idahoans across the state define their role in enhancing these programs. And the initiative will share peer-to-peer stories of how others are stepping up for quality early childcare and early childhood education. Excuse me. And will provide specific resources for various groups. Excuse me. We also learned I do not have COVID. Excuse me.
I've heard your presentation a number of times. Do you want me to just jump in and do it?
I do. I apologize. Something got stuck in my throat. Okay. What we also learned is that we have a very large childcare desert in Idaho. And in fact, half of Idahoans live in areas that the demand for childcare is much higher than the supply. And because of that, we started to lay the groundwork to increase the number of childcare programs in Idaho by creating childcare business startup guides. And these guides will be used over the next several years as a tool for those who are wanting to start a childcare center or a family childcare home. To address the quality of childcare, we also offered incentive grants to childcare providers across the state. And these grants were in partnership with the Idaho STARS project, which is intended to improve the quality of childcare throughout Idaho. Much of the grant focused on school readiness and literacy, And we did a lot of activities that focused on that early learning and literacy approach that the governor's priority really points to. Next slide, please. Okay, so I'd like to take a few minutes to talk about a unique Idaho approach that we designed to address the lack of affordable quality childcare and school readiness. A few years ago, we started to lay the groundwork for creating what we're calling local early learning collaboratives. And this approach puts local communities in the driver's seat as they navigate how to best serve young children and working families. We know that communities throughout Idaho are very different, and we know that the approach to serving families really depends on the community needs and resources available. A local early learning collaborative is where local leaders come together to design and implement an early childhood system that works within their community. So it could be a child care center that partners with a school district, that partners with a business to really design and build a child care and early childhood program that works within their community. As Alex said earlier, North Idaho is very different than Western Idaho, very different than Eastern Idaho. And all communities have their own unique challenges, and they all have their own unique ways that they can solve this problem. So currently we have 16 local early learning collaboratives throughout the state that we have utilized the preschool development grant to build and expand. In the future years, we're looking to expand this framework across the state. These local early learning collaboratives are really built on that public-private partnership. And we know that one sector is not going to fix this child care challenge that we have in the state. We know that it's going to have to take partnerships between, like I said, businesses, policymakers, and communities to help solve this problem. Next slide, please. So as we wrote this grant, last year, we all knew that we were going to have the opportunity to apply for a renewal PDG grant. So this year, Governor Little gave us the permission to write for this federal preschool development grant as a renewal. And this grant is a 3-year grant that will help us expand the efforts that we've done last year in terms of building opportunities for childcare and early childhood programs throughout the state. We were awarded this grant just a few weeks ago. Idaho AEYC and the State Board of Education will partner in this effort to make sure that we are building those opportunities for working families and young children. Some of the activities that we wrote into the PDG renewal include childcare startup grants. So we will be working with communities throughout Idaho to build and expand our childcare. Because like I said, so many of our communities, they live in childcare deserts, so that we just don't have that supply. We are hoping that our business community will join this effort as we are working through some of the activities in PDG as we're building these local early learning collaboratives, because we know that if we can do this, we will have more opportunities for a robust economy and put Idaho in a position where it is more attractive to start a business, to open a business, and to recruit and retain a qualified workforce. I think one of the final things I want to say is that childcare, understanding childcare system in and of itself is unique and it's interesting. And it comes with its own challenges. It's important to remember that childcare businesses are small businesses. They're privately run, they're privately funded, and where we are now is that our childcare system is broken in that our childcare providers make an average of about $9.77 an hour, and that's without benefits. And so to keep that business going, it really is going to have to look at how do we fund our childcare system with both public and private dollars to ensure that they can keep their business going while at the same time serving families. Families are paying a tremendous amount of money to pay for childcare, and oftentimes it's out of reach for a lot of families. And so ensuring that, we're in a situation where our childcare providers can't make any less and our families can't pay any more. So who fills that gap? And again, we're looking at business leaders and policymakers to help support these efforts so that our childcare businesses themselves can sustain themselves, because the more that we can build these and sustain them, again, the better off that we will be with our economy. So with that, I will turn it back over to Alex and see if we have any questions.
Yeah, and I'd like to just add to that. I mean, functionally, this comes down to dollars and cents for us and for the families themselves. There is a population out there that have been identified in the past, referred to as the asset limited income constrained group, or ALICE population. These are folks that are actually working, but they're also the ones that can't take the job promotions, or the ones that have to voluntarily leave, or the ones that are missing 16 days a year of worker productivity as a result of lack of available childcare. It is vitally important that these childcare systems are of high quality, and that's where Beth's organization comes in. But let's be very frank. This comes down to dollars and cents. So, and childcare is an expensive proposition. There are certain portions of our populations that simply cannot afford it, so they have to make these other decisions that become detrimental to their employers and to the economy in the state of Idaho, which is why we're losing close to $500 million a year in productivity. So what kind of an investment can be made into that? And that's really the question that I think that we're starting to ask within these local collaboratives. Because like I said before, a lot of our major employers, a lot of our members have the capacity to go ahead and solve this problem on their own, and they will. And make no mistake about that. They will take care of their own, but every employer has this problem. And so that's where these local collaboratives become vital to any community that's out there. We don't really care whether it's started by a parochial system or a public system, or just a group of people that get together of employers and decide that this is what they want to do. As long as they meet the quality standards associated with this is something that I think is the right path, and why the PDG grant is vital to the long-term success of the state of Idaho. It's not a one-size-fits-all. It's not just preschool. It's something that communities can do for themselves and be successful over the long haul. Is there a role for the state at that point? Perhaps. We haven't quite got to that point yet, but we're not going to say no to those that want to help us work and try to solve these problems as well. And I think it's our responsibility and role to provide that information, to provide the data that shows, outlines the problem, and offer up some flexible pathways like what Beth's programs have done. Thank you.
Yeah, I'd also like to follow up on what Alex said about, oftentimes Alex and I get asked, what can we do as business leaders, right? And I think so often the answer goes to just start a childcare center. Well, let's not jump to that conclusion first and foremost. There are some things that businesses can do. For instance, your HR departments are instrumental in helping to solve this problem, in that oftentimes a mom will go to the HR department and say, hi, I'm going to have a baby. What do I need to know about leave, etc.? And the HR department will most likely say, here's information about FMLA or whatever. Good luck. We hope you come back. What if an HR department said, oh, have you thought about childcare, and connect that expecting mother or father to childcare programs within that community if they're available? So we need to do a better job of connecting our business community with our existing childcare programs. That is a tremendous partnership. Businesses can help support their employees by helping to pay for some slots in a childcare, for instance. So there are some things that we can be looking at and doing, but it just hasn't existed. And we're happy to help connect businesses to childcare programs in their local area. If we run into a community where there are no childcare programs available, or the waiting list is so high, like you saw in the video with Kootenai County, how do we work together to expand those programs? And that is really through a local collaborative approach. So there are a lot of things that we can do. On our website, idahoaeyc.org, we have a business toolkit. So business leaders there's a variety of tips and suggestions and resources available for our business community to look at and start thinking about this. But we need to engage our HR departments. And again, we're happy to help with that.
Alex, Beth, that was a lot of information, but very awesome. And I think it's huge for Idaho's economy, like you said, in a kind of a missed area that we're missing on. Hopefully we can bridge some of those gaps that we have. Kind of as we wrap up for today, I just want to say thank you again to Beth and Alex. They will be joining our legislators here in just a minute to answer any questions that they have. And I just want to thank our audience for tuning in today. And once again, we can't provide this kind of content without the investment from our members. So I'd like to thank our presenting sponsor, the Idaho Statesman, our event sponsors, Blue Cross of Idaho, Intermountain Gas, Optum, Idaho Central Credit Union, and Southwest Airlines, as well as all of our district sponsors that made this event possible today. Be sure to tune in, and we do have another event this afternoon. It's our COVID-19 vaccine distribution event at 4 o'clock when we speak with Idaho State epidemiologist, Dr. Christine Hahn, and the Director of Idaho Health and Welfare, Dave Jepson. Again, thank you all for joining, and we'll see you on the Zoom with our legislators in just a minute. Have a good day.